Today, many adults and children have been able to heal with the help of what is known as alternative medicine. Once thought to be on the fringe of medical science for most Americans, alternative medicine has quietly jumped into the mainstream. In 1990, Americans made an estimated 425 million visits to alternative healthcare practitioners, spending nearly $14 billion. And in 1993, a third of adult Americans used at least one alternative therapy. Why the surprising popularity? Some Americans find alternative approaches less expensive, with fewer side effects and reliance on medication. For others, it's the human touch that is the true appeal. Many are simply taking more responsibility for their own health. There are about 300 alternative medical theories taking varying approaches to health problems. The field includes vastly different treatments, some of which are thousands of years old. The common thread is that they attempt to treat the body, mind, and spirit as one. Often these therapies do not cure a problem, but restore the body's ability to heal itself. In this program, we are going to explore some of the more popular alternative medicine practices in this country. We'll talk with ordinary people who achieve relief from everyday health problems with therapies that have proven to be very powerful healing tools. Chiropractic, with nearly 50,000 practitioners, is the largest drugless, non-medical healthcare profession in the world. Modern chiropractic was founded in 1895 by Dr. David Palmer, but manipulation of the spine has been part of the healing process of many traditional cultures, dating back to the ancient Greeks.
Hippocrates, who was the father of medicine, said, when in sickness, look to the spine first. And he wrote many theories on how to manipulate the spine. Remember that spinal adjusting goes back to ancient times. Before medicine, there was spinal manipulation. So spinal manipulation has been here since time immemorial.
Dr. Stephen Dean has been practicing chiropractic in Springfield since 1968. A former president of the Massachusetts Chiropractic Society, he has been recognized on numerous occasions by his profession and for his work in the community. Over the past 30 years, Dr. Dean has helped people of all ages maintain their health and avert disease and sickness without drugs or surgery, in effect, maximizing the body's potential to heal naturally.
Chiropractic is based on the premise that the movable segments of the spine, and there's 26 movable segments of the spine, can go out of place, not to the point where they break, but actually through falls, injuries, trauma like car accidents, or even the accumulative effect of occupational jobs, can misalign in the spine. And when it does, it creates what we call vertebral subluxation complex, or a bone out of place. So chiropractic is the art of finding those bones which are out of place that interfere with free movement and cause pain, and by hand correcting them through chiropractic adjustment. Sometimes they call it a manipulation, but it's actually an adjustment of the spine. The spinal nerve rootlets, there's 31 spinal pairs of nerves that go through the vertebrae. And because the vertebrae are movable, and a whiplash injury like a car accident or a fall can pinch these nerves and actually interfere with the function of the body through compression. Science has shown that compression of nerve rootlets cause visceral or organ failure. So when you correct the spine, you actually free the nerve and give the person not only freedom from pain, but correct why they have the pain to begin with.
What can happen to someone if the spine is misaligned?
Well, the spine locks or it fixates, and eventually these are a series of pictures that show a spine, the same spine of a person over 30 years, actually without correction. This doctor took it was in a medical book, that showed that this phases of degeneration of the spine occurs because the spine wasn't fixed. Again, using dentistry. If you have a toothache, you respond to treating the cause. If these patients just took muscle relaxers, exercise, and didn't make correction of the mechanical freedom in their spine and the fixation in their spine, they would actually break down. A lot of studies show that joints become arthritic because they're bearing pressure and they've developed calcification and become restricted. So that the short term is people have pain and they come in for help, but the long term of misalignments can cause breakdown of the body, where people actually get shorter. If their spine's twisted, their discs that comprise 7 inches of their height actually makes the person smaller as those discs degenerate, because most people talk about those discs. If I could show you on that spine here, the discs of the spine that most people are concerned with are right in between the vertebrae, and they're shock absorbers. If the spine twists out of place for any length of time, just like down in here, the disc can herniate. A disc can't really slip. They say a slip disc. It can't slip. It's attached to the bone. But it can protrude and press on the nerve, causing pain. But this usually comes from a long-standing chronic back pain that finally breaks down to the point that the disc herniates, just like with an abscess. A long-standing dental disease causes abscess. Long-standing mechanical pressure on the spine can cause a herniated disc, pressing on the nerve and interfering with the function of the body.
A chiropractor locates and removes the vertebral subluxation, which prevents normal, healthy body function.
Subluxation is the condition in which one of these bones or more have gone out of alignment, which causes the pinching of the nerve, the pulling of the muscle attached to the bone, causes pain and limitation of movement. So a subluxation is a bone out of its normal alignment.
While many people seek a chiropractor because of back pain, it is also used to treat a variety of ailments.
People come from headaches. Some people come for stomach problems, sinus pressure. Some people come from having neck pain from a car accident. Some people come with pain down their hands, what they call bursitis or neuritis. They come in, you name the condition, a lot of people have come in. We've had people come in with many diseases of their body, and they've come in for relief. I've even had cancer patients come in not to treat cancer, but for the side effects of the stiffness and the pain from either therapy or the breakdown of the body through the degeneration of cancer itself. It doesn't cure cancer, but these people have found that improvement of their structure gave them some relief. In this case, it's a relief practice. But basically, the big asset of chiropractic is to keep people well, keeping their mechanical freedom so they don't get down from good health to bad.
Some, however, come to Dr. Dean after suffering needlessly for weeks, months, or even years.
Most people that come in here, they say, I've come here as a last resort. And I say, well, there should be a motel sign outside because a last resort. But the whole fact is that that's not what we want to teach today. We want to teach wellness care and how a simple adjustment when you're very young might prevent a lot of problems when you get older. I'm pretty much the conservative old school that principally adjusts the spine by hand only. The new phase of chiropractors, a lot of them use physical therapy and they work on rehabilitation. I work mostly on wellness. Most of our patients are pre-active in taking care of their health rather than reactive to a fall, an injury that brings them to a doctor.
Chiropractors must undergo extensive training before becoming licensed in Massachusetts.
All chiropractors have to have at least 2 years of prior college and 4 years of chiropractic college, pass a state board of examination. I was number in this state 260. Now there's probably 50 times that in chiropractic today in Massachusetts. So basically you need a full education. You don't get it in the Cracker Jack box.
What factors are important when seeking chiropractic care for the first time?
Word of mouth has always been the way most people go to doctors. And if you go into an office that is clean, a doctor that's educated and has a standard, who's kept up his license, that's the doctor you go to. Most chiropractors are competent.
Many chiropractors have joined forces with medical practitioners of all types for the benefit of their patients.
We work together, doctors of medicine, myotherapists, physical therapists. We all should work together for the good of the patient. And we can all work together because this is the new age. This is when common bridges are being formed in these alliances. There are books now on manipulation being written by medical doctors. They founded the North American Academy of Manipulative Medicine, in which all they do is manipulate the spine.
Several of Dr. Dean's patients spoke about the benefits each one enjoys from chiropractic. Steve has been seeing Dr. Dean for over 15 years. He initially sought treatment for the same reason most patients seek chiropractic care.
My lower back has kind of always bothered me. Ever since I was a kid, I fell off the school building when I was probably about 8 years old. And back in those days, you had a sore back and it kind of like went away. Chiropractors were unheard of in the 50s. And over the years, through my teenage years, I just kind of lived with it.
Many people are traumatized early in life, but never seek help.
Curvatures and malpositions and physical conditions that cause pain at 30 might have started at 10 when you fell off your bike and you pinched your nerves. In fact, a 30-year study in England just recently composited over 14,000 different people showed that 80% of the chronic pain that these adults had started when they were very young, when they were injured and weren't treated.
My dad had received back surgery in his younger days, and I've seen the excruciating pain he went through even after the surgery. So there was no way in the world I wanted to go through that if there was an alternative way.
Steve gained relief from his back pain and continues to see Dr. Dean to maintain his activity level.
A lot of skiing and water skiing, snow skiing, rollerblading, you name it. I have to keep up with my children, so I live that lifestyle that brings me here occasionally to get myself back in shape. If I hurt myself, I come, obviously, and then probably seek, 4 or 5 treatments. But I also come on a regular basis just for like a tune-up. You bring your car to the shop for a tune-up, or we come see Dr. Dean for a tune-up. Even sitting in an office chair all day, and I have a strenuous job, so I get, back and neck pain just from being tense. And when I get my neck adjusted and my back adjusted, I feel great.
Dr. Dean demonstrated some of the steps involved in a typical visit for Steve. A complete adjustment normally takes up to 15 minutes.
What we're going to do with Steve today is we're going to check his spine. Turn around, Steve. I can feel through Steve's clothing because I know his back from prior. When he first came in, he didn't have a shirt on. But I know his listings now, or the bones that go out of place. As a result, if I can feel through a muscle or feel a bone, I can feel through a light layer of clothing. We're trained to do that. First, what I'm going to do is I do a scan, a pre and post scan of a person in 2 aspects. First, I check their temperature of their muscles, and this machine will show you. It's an infrared scanning device that they use. And we just do a scan up in his neck just to see exactly what his blood temperature is. Muscles which are spastic or injured actually generate more heat. Yeah, some people would even say, I got a hot low back. So a lot of times you can see this as a pre and post check. So we're going to do a scan on him, and then we're going to put him on these scales over here. We're going to put him on these 2 scales in this distance. And we're going to check his balance to see how he's distributing his weight. A lot of people, when they're favoring their spine, before they even know it, they're resting more weight on one leg than the other. We pre and post check, and actually we can change the body mechanics of the spine through manipulation to where we can center the back. Joints that wear out because they're not level. You can't possibly wear your hand out. You'll get calluses. Your back won't wear out. It will calcify. So if you're out of balance, you will actually start those curvatures that kids have at 15, 16 years old, or that causes someone to just absolutely not stand upright. And you can see that by weight balance. Then we're going to put him on this adjusting table, and this is a platform made to adjust the spine. And it's got a headrest place and a centerpiece to relax the mid-thoracic spine or the mid-back, and a place in which he'll lay down on. And then we're going to feel his back, because the most important tools of a chiropractor is not the instruments I mentioned, but his hands. His hands can find bones out of alignment. Just like a pianist can play a piano or a blind man can read Braille with his hands, I can feel his back, go down his back and make adjustments to his spine. And all it is a push of a muscle with a little pushing, and that spine will actually move. I'm going to start in the cervical area, the neck area, and I'm going to feel his back all the way down to the segments of the spine. And this is the sacrum. This is that base part of your bones. So Steve is pretty good today. He's a little out right here, right, Steve?
Yep.
And your neck is out right in the spine. Okay. So bone is out here. That goes with the neck. This is in the mid-thoracic spine. And we're just going to take one move. Take a deep breath. Let it out. Okay. Actually, it moved on touch. And we've got one right here. We're going to take and just drop your shoulder. Good. Okay. Okay. Okay.
Dr. Dean adjusts Steve's pelvis.
We're going to lay on his side. We're going to adjust his right ilium hip by taking a contact of his lower sacrum. Okay. Just completely relax, Steve. Just drop your shoulders a little more. Okay, a little more. Okay. Good, a little more. Good, very good. Slide back over. Now we'll do a leg check. The reason for that is to see how we move the extremity. That's pretty good. Now I'm just going to feel his neck. Most people fear adjustments of the neck. And actually, if you watched football or basketball, you'll know that you get a lot more force than that. We're going to take his head, and let's have the weight of your head in my hands. And we're going to just feel his neck. See, we can feel his spine right here. And all it takes is one little finger to adjust the neck here. We're just going to try to go limp completely. And we moved his spine, didn't we, Steve?
Mm-hmm.
And then I feel his neck, again, with the weight of the hands, his head in my hands, and he's in line, and I just felt his spine right here. Okay, I'm going to put this pillow back to relax his cervical spine, and we've adjusted this patient as far as I'm going to do right now.
Steve receives a post-check scan and is back on the scales.
So right now he's perfect. He's 1 pound out of balance now because we adjusted his right hip and we adjusted his neck. Okay? Okay, Steve, thank you.
Feel great. I think every chiropractor has their own, method of doing things, their own approach. Dr. Dean's a very hands-on guy, to coin a phrase, but he really knows his business, and he's picked up things that my other chiropractor didn't pick up. And when he adjusts me, believe me, I leave here feeling like a new person. Mm-hmm. He's has a lot of expertise.
One morning, basically, I woke up and I couldn't walk and I couldn't bend over and I was in a lot of pain and I felt an intense amount of pressure in my lower back and my sacrum. I work as a massage therapist, so I had some of my fellow therapists work on me and got very little relief from that. So I knew I needed something else.
When she came in, she had pain in her back here and pain down her hip. She had trouble walking. It was one of her gait problems. When we x-rayed her, this is the x-ray taken of Catherine, this shows the hips on both sides, the sacrum, which is that base bone, and the vertebrae. And here you can see the mid-thoracic spine where she has a misalignment. Her spine up until this point was straight, and then it curved and pulled on her back. Her hip is out of line. These plumb lines show her pelvis was out of alignment. Fortunately for her, this is an acute injury. She didn't have any bone disease. Her spine is perfectly formed. It's just out of alignment. So what we were going to do is, and what we did successfully with Catherine, is to realign her spine and mechanically restore the proper movement of her hip. That took away her pain. Most people, if they go with allopathic treatment, would be getting rid of the muscle spasms and the pain. We adjusted the spine, corrected the malpositions of her vertebrae and pelvis, and the pain went away because the cause was corrected. See, that's the basic difference between just drug symptomatic relief and correction of a cause.
I knew I needed to go to a chiropractor as opposed to being treated by the MD because I didn't want painkillers or anything like that because that would just mask the problem. I knew that there was an underlying problem and that needed to be treated in order for me to really, truly get better.
Dr. Dean confined his treatment to the thoracic spine and lower back area. There are about 20 different spinal adjusting techniques used by chiropractors. Dean incorporates 8 in his treatment.
Now I'm feeling her spine. I'm going to look at her pelvis. She's high on this side. I can feel I have my hand right on her spine. And this is tender right here, isn't it? Okay, and then we're going to take and check her leg length, and she's out of line there quite a bit. It's a short leg, you can see it. Well, let's do your thoracic spine first, because you're really tight, okay? Just take a deep breath. Right by her bra line, she's out of line right here. Blow. A little more. Good. I had to adjust her today because she needed it. You okay?
Yes.
Okay, I'm going to just check her spine here. I'm just checking her range of motion of her spine. Okay. I'm going to just take and put a little pressure with this wedge underneath her spine. Let's just take a deep breath. Let it out. This is to get her spine ready to adjust. I wedged the spine to put it in a certain position, then put pressure on the sacrum to release it. And I use my hands. A lot of times I will stretch the muscles to do it.
Sometimes patients with acute pain may experience some discomfort during an adjustment.
If it hurts for a person to move normally, then adjusting them won't be painless because you're moving their part. But normally an adjustment doesn't hurt in and of itself.
Dr. Dean releases Catherine's pelvis.
Okay. Just like when she works with patients with muscles. If they're very tight, then we're just going to just do it easy. Stretch back. Okay, a little more. Okay, a little more. Okay, very good. Nice, easy release, huh? Okay. And that didn't hurt, did it? Now her spine's out in 2 different directions. So now we're going to go and do the other side of her pelvis. Now we're going to go and release her sacrum on the other side. I'll have you bend your knee like this, okay? Okay. Just come like this. Okay. And just stretch down. Let yourself go. Just let that leg drop a little more. Okay, a little more. Okay, good. Lay right on your back. Actually, people hear a noise. Did you hear a noise? It's synovial fluid changing in a joint. That's that popping sound. And manipulation, they have found out that that popping sound represents the movement of pressure in the joint. So that's when people hear a clicking, it's actually the joint moving. Nothing's breaking. Nothing's like you cracked my back. There's no such thing. Okay, we're going to just check now in our leg length. We can see that the leg length is normal now. We've restored the movement to her pelvis to get it normal. We're going to just check her range. See if this feels a little looser to you now.
Oh, yes.
See, we're going to check that range. Just lift your right leg up for me. We're just checking to see her range of motion is. And see that sacrum here, it's freed up. This part of her back is free, not pinching again. Let's have you just come over here now as a post check. We're going to do the post check and then she's out.
And how does she feel after an adjustment?
A release of the pressure that I experience in certain areas of my back, a release of tension, just kind of feeling.
While Catherine felt less pressure in her lower back after only 4 visits, it can take much longer to heal.
It depends upon the condition. Some people, one adjustment might be enough. Most people take about 12 here in the office. Some people that have had a work-related injury or a auto accident might take 20 or 30 visits because they've been traumatized, causing damage to their body that has to have all these muscles to regenerate themselves, and that takes longer because you have to hold your adjustment. So it's very, very important that people realize it depends upon your condition.
Like Steve, Catherine comes in for a wellness adjustment periodically to maintain good health.
After I do get adjusted, I feel like I have a lot more range of motion in my spine, which makes my stretching more productive, and when I work out, I have that range of motion, and I feel like my exercises are more productive too. And I just feel better when I do them. And also, I want to continue to come to Dr. Dean because I don't want to wait till something like what happened happens again when I get to the point where I can't bend over or I can't walk. So I feel by coming once a month or once every couple months, you know, and maintaining what he's been able to do, hopefully I won't be in that position again. I think that's what's important, is to not wait until you have, you know, a severe problem, but to try to take care of yourself in between so that maybe that won't happen.
Michael was looking for relief from the aches and pains associated with the physical nature of his work.
I do out-of-body work for a living. I went on my own, opened my own business at the time, and I had to do a lot of the work myself. A lot of it requires bending down, blocking sides of cars, buffing. So one Sunday morning, just the way I got out of bed, I couldn't turn my neck. I was bound up, and he has the radius tool that he checks your, you know, how far you can turn your head, and I couldn't even move it that morning. And he seen me on a Sunday, and he relieved that pressure, and then by Monday I was able to move my neck again. That's probably, you know, the most scariest time I had because I don't know what caused it. It started to affect my left leg, and lower sacrum is what goes out on me, and when I saw my leg, you know, acting a little strange, walking a little crooked, I just knew I needed some attention, and I came back and I made a statement to Dr. Dean. I said, there's no monetary value you can put on your hands what you did for me the other day, because he relieved that pressure. I walked correct again. He checks my balance, and I've had 3 treatments up to today, and you know, I'm like brand new.
While Dr. Dean recognizes the accomplishments of Western medicine, he disagrees in principle with the traditional healthcare system when it comes to spinal care.
The thing that's hurt chiropractic today, the biggest threat, is managed care. Managed care is because the medical doctor and his mindset won't permit a person, if he's the gatekeeper in the HMO, to go to the doctor of their choice if it's a non-medical doctor. Chiropractic believes that treatment of disease is not as important as the correction of the cause of why someone's sick. That's alternative. We believe that if a drug hides your condition, that's not as important as reinstating your function. Certainly, if your heating system broke in your house, you wouldn't bring another heating system in before you found out what was wrong with your system. When someone gets broken down, the doctor says, for the rest of your life, take these pills. and you obediently take these pills, never believing that maybe within your body is the same power that healed you, like from a cut or a strain, that your body has that potential of getting well. So I'm saying that's alternative. Alternative to taking a drug for a headache or a stomach pain or a back pain is correction of the cause and feeling good because you are good, not because something has sedated your symptoms of it. That is alternative.
Dr. Dean has found that his patients today are more informed and willing to take responsibility for their own health.
People are more physically conscious today. They've decided to take and make their body last as long as they live. You know, they're treating their body like they did the new car now. They're not just abandoning their health. They're eating properly, they're exercising, they're becoming more active in participating with their own health. As a result, they've come to us. More people want a non-medical answer. Drugs are not the answer to most diseases.
Dr. Dean gets a tremendous satisfaction from being able to improve the lives of others naturally, without the use of drugs, and to educate as well as heal.
The greatest gift that you can get out of being a chiropractor is have a unique relationship with another person. Laying on of the hands and helping somebody when they're in a time of physical need is a tremendous experience. It's a great experience when you can give people, without radical treatment, without surgery or drugs, give them a relief from an ailment that might have lasted for 20 years. So the greatest gift that I have is not only that, but the friendship that I have with the patients over a long period of time. Just this morning, one of my patients brought me vegetables, and they bring me cakes, and they come to office picnics, and we're like a family. So to be part of the fabric of another person's life through just putting my hands on them is a great, great privilege. And it's the way that Marcus Welby once did it, and Ben Casey. I'm the old world kind of doctor. I believe in that body, mind, and spirit of people's treatment, not just the physical, but the whole amount. Most of my patients, they know me and my life, and I know them. So the greatest gift is to be able to, without force, without surgery, without cutting, give people relief and correction and a reinstatement of their health understanding. So the whole idea is that the spine is a respected system. The first system that's ever seen on videotape when they show a developing embryo is the human spine. That's the first thing to be seen. And that's why it's so important. Everybody needs to have their spine checked. It's just one part of a necessary, normal, sequential form of health prevention or health care instead of disease treatment. Everybody needs a chiropractor.